Welcome back. As we are in the thick of the holiday season, we are constantly reminded to give back to those in need, right? Well, this year, why not consider donating and saving a life? Here to tell us everything we didn't know about bone marrow donation and advancements in treatments is Dr. Andrew Pecora, who is with one of the top hospitals for bone marrow transplants in America. Good morning, doctor.
Good morning.
Happy holidays.
You too. Happy holidays.
Yeah, so I do think this time of year, families and people, they're looking to give back a little bit more, and certainly charities are top of mind this time of year. So talk about bone marrow donation and why people should consider this time of year. From what I understand, this is very, very life-saving.
Yes, absolutely. So each year in America, about 12,000 people are diagnosed with blood-derived cancers such as leukemia, lymphoma, multiple myeloma. And for those particular individuals, the only chance of being cured is through a bone marrow transplant. And the way to get a bone marrow transplant is you need a donor. And unfortunately, even if you have a large family, your chance of finding a donor within your family is 25 to 30%. So that would mean 70% of people, and this is the way it used to be, would have no hope of being cured. With people actually willing to donate their stem cells, their bone marrow, through the National Marrow Donor Program, we've dramatically increased the availability of bone marrow. So now about half of people who don't have a brother or sister that's a match can have a bone marrow transplant. And the most exciting news is that the outcomes, the clinical outcomes, are identical whether or not your bone marrow comes from a brother or sister or an unrelated donor. And that's why I'm here today promoting people to consider becoming a donor to potentially save someone's life. Wow.
So who is the ideal donor? Is it a particular age, a particular gender, or is it just anybody, everybody? Who should consider doing this?
It's really everybody, anybody. There are some groups that are underrepresented in the national donor pool, such as African Americans and Latinos and Asians. And those groups, it would be nice because when a member of a patient with that sort of background seeks a donor, it's harder for them to find a donor. But it really applies to everybody, and it's such a simple thing to do. It's basically, you would go to the website bethematch.org, bethematch.org, and it'll direct you to a facility in your local area. You fill out a questionnaire, you have a cotton swab of your mouth. It doesn't hurt at all, and we get enough cells from that we can determine your immune address, your HLA type. And then me as a doctor, when I'm looking for my patients, I get their immune address and I see if it matches up to yours, and if it does, you're called in to become a donor.
Okay. Well, and I do think we need to address something. From what I've heard, is this painful to be a donor? How do you actually get people to come in and take this next step?
Well,
and, like
let me start by saying the vast majority of people who actually do donation want to donate again. And the reason for that is it actually is not all that painful. There is some discomfort to it, no doubt. It's totally voluntary. You can change your mind at any time. You're under no obligation. It's totally private. Nobody knows other than you and the doctor that's dealing with you what your choices are. But you can donate your stem cells. You can either have them taken from your hip or taken from your blood. And in both circumstances, there's some temporary discomfort, but rarely is there anything long-term, and the vast majority of people are back to work and back to their lives within a week of donating the cells.
Okay, I think that's good to let people know that. Well, as we close here, what's the take-home? What would you recommend people do today?
Well, you truly can potentially save somebody's life by doing this. So go to bethematch.org, bethematch.org, and become a donor.
All right, doctor, thank you so much. And again, happy holidays, and I hope we can help save some people's lives this morning.
Thank
we appreciate your time.
Opportunity.
Of course.